third take, and I haven't even made a word. Okay, here we go. Vaping. Why is it killing people? Number one, there are so few cases, no one's going to know the answer. I'm not a source. Number two, the only place I found a clue is in the one case that was studied compared to another case that was studied and had somewhat complete data. Next, people keep getting diagnosed with the actual medical problem that is killing people and refusing to stop vaping. I'm going to say something you don't want to hear. If you've selected yourself for extinction because you won't stop doing something that is literally killing you, then you will die. Let's just get that out of the way, first minute or so. First of all, we're going to get a couple of terms out of the way that medical people keep making these medical terms that sound stupid. If you look at an x-ray and see something that looks like a T-bone and say that's a T-bone effect on a x-ray, that makes sense because you're describing something superficial appearance. If, however, you use the following expression, ground glass opacities in the lungs, the first fucking thing that's going to happen, besides people screaming chemtrail, is that it's glass beads or glass ground material. No, it's called ground glass opacity, which should be as frosted glass. A radiological finding in computed CT scans named for a hazy opacity that doesn't obscure the underlying bronchial tube structure in the lungs or pulmonary vessels, but it looks like ground glass opacity. It looks like it's frosted glass. It does not indicate glass or silicates in the lungs. Yes, someone immediately is going to jump on this wording and keep screaming it. So I'm going to put it in the title of the video. Fuck it. You find this video, that's what it is. That's like me saying that the voltage is spiking and it's producing, that the signal on a video signal like this is producing a herringbone signal. It doesn't mean it contains fish, it just means it's making spikes that look like the spinal column or the rib cage of a herring. That's literally what the term comes from. E-cigarette, vaping, hash, or standard oil, or vegetable glycerin contained within vaping cartridges, heated up to produce a vapor. And if brought up to a higher temperature, it can caramelize. Think scalded cooking oil. All right? Okay, think of that effect. That's not what's happening, but I'm going to use that again. We're going to call it the cooking oil effect. I'm just going to make up a term here because it's descriptive. See how it's misleading already? Anyway, it's heated up to produce a vapor. And you can have glycerin-based stuff, all sorts of things that are used for vaping products. It's not regulated as to what's used to make it work. I thought it had been standardized because it's based on the same stuff fog machines was made for, but then again, you don't walk up to the fog machine and literally inhale it. I thought it was based on the same methodologies for vaporizing material for people dealing with bronchial issues where they'd inhale a medication. But it's not regulated like that. And more importantly, nobody thought to make sure it was standardized by using shit that was found safe and effective over a very long period of time. So what I'm saying here is, because the cigarette industry didn't decide to use safest practice, that's what happened. The people making these mixtures, including some of you homemakers, may have picked something that sounds perfectly safe, like vegetable glycerin, and ended up causing this. Why? Here we go. Tiny aerosolized droplets of lipids can be inhaled. Lipids are basically fat. Lipids or lipoids are fat molecules. They're just a class of molecule types. That can include any oil. They can also include things that you can't actually digest, but they're called fats because they have the same characteristics. Okay? And yes, that means instead of using something that came out of an oil well that you can chemically control down to the last bit, people were using stuff that seemed safer, like, let's say, corn oil or something. And because it is something biological based, instead of your body getting it out of your lungs, it stayed there. Particles may enter the lungs and cause inflammation and irritation reactions later on because your body isn't expelling them. of all things, using the least dangerous sounding shit again is biting us on the, destroying us. This condition has similar symptoms to bacterial pneumonia, which is what everybody's assuming it is. It isn't. It's an irritation in the lungs causing pneumonia. Pneumonia is actually just the irritation factor. It can be caused by anything. It could be caused by inhalation of anything can cause pneumonia. You can get pneumonia from a chemical reaction, which is what they're suspicious of it being. But the only thing found consistent is that it involves lipids. And it's being called, the pneumonia type that it's been given a name for. And it's only associated originally with accidental aspiration, inhalation, or vomiting up and inhaling oil-based materials. This included laxatives, or literally cooking materials. I have one little story. At one time, I was literally so miserable. This happened a very long time ago. I was a dumb kid. I literally cried myself to death, it seemed like, for around 8 days. In the process, I ended up having to go to the hospital with a really strange form of pneumonia. I just checked my records. It was the same condition. Basically, my own tears, the oils from my tears and my sinuses and the mucus, I gave myself pneumonia by literally crying because I was so emotionally screwed. I had a job, an apartment, everything was going fine, but I was still miserable for some reason. Yeah, that really happened. I'm my own worst enemy. But anyway, previous oil-based materials could include anything. You could induce this in people by spraying them, making them inhale all sorts of stuff. The end result is being on oxygen and antibiotics potentially for several months or weeks or unknown period of time, and still ending up being sick because the damage may not be repairable. It took me 2 years to recover from that and 5 years to recover from a sequence of getting pneumonia over and over again, normal pneumonia. Again, if all you have to do is, while you're healthy, not use this stuff, you better not use this stuff. Maybe someone can find something that does not involve lipids or fat-like materials for vaping products. Maybe that'll fix it. There's only there's 7 people who've died from it, and there's like 380 cases in 36 states. That's about 10 people per state in the United States. But it's the sudden onset, almost like somebody changed up or changed down to a cheaper product, like some sort of vegetable oil, or vegetable glycerins. The only thing they're listing now is probable and confirmed cases that have enough characteristics to make a match as a group. They still don't know. It could be reduced down from the 380 cases down. Respiratory symptoms include the following. And these are very, very generic, but they get a lot of them. Coughing, shortness of breath, chest pain. Gastrointestinal symptoms, nausea, vomiting, and diarrhea. Yeah, because any oil you ingest in any way could cause this. One of the things people do when they have phlegm is they swallow it. I'm being gross, but that's what you all do. Most of you do. I don't. I can't. Because it will cause my digestive system to evacuate. I can't swallow my own mucus. I have to spit it out or blow it out through my nose. I found this out about 2 decades ago. People are like, why don't you swallow it? I can't. Why? Because it'll literally make me sick. Or I'll throw up. They may be very related. Next, and diarrhea. Oh, well, thank you for listing that. I forgot. Non-specific constitutional symptoms. That does not have to do with Second Amendment. Fatigue, fever, weight loss, malaise, inability to stay awake, that sort of thing. Typically developing over a period of days, but sometimes can take several weeks. However, it's relatively sudden. The one thing they all have in common is a lack of bacterial infections or viruses. Nothing comes out when swabs are done. And then when they check the lining of the lungs or the bronchial tubes, they find lipids. They have to do that test. If somebody goes in with this sort of thing, all you have to do is say, I'm a vaping user, check for lipids. They'll probably be there. Check for that and bacterial and viral infections, because they can be comorbid. You can have both. I've had a bacterial infection try to kill me and a virus at the same time in my lungs, sinuses, and eye sockets. I'm like the last person on earth you should be talking to about this, but someone asked me to look this up. Anyway, Gastrointestinal symptoms sometimes precede respiratory symptoms and the other way around as well. Fever, tachycardia, heart problems, breathing problems, elevated white blood cell counts have been reported in the absence of any infectious disease, which could be an indication of the inflammation response causing your body to get confused and send white cells into your lungs. I've gone through that. Your body tries to fight a non-existent infection, and it makes it worse because it starts attacking the lining, which means your lungs fill up with pus. Radiological findings have varied and are not present in all patients. That means the x-rays don't show anything consistent so far. Bilateral pulmonary infiltrates of diffuse ground glass opacities have been reported. That just means it looks like it's a fogged over picture. That's to be expected. Patients requiring supplemental oxygen, assisted ventilation, oxygenation, and intubation. That's where they jam the tube down your throat and force air into you. And they also talk about, I just got to say this, irrigating one lung, cleaning it out, then getting the oxygen level up, hanging a person upside down, and then irrigating the other lung to wash it out and get everything out of it. None of these are a placebo, panacea. They don't solve everything. You have to do a bunch of these things. When you have to do that many different things to fix a problem, that means there's no real one cure or cause, usually. Or it's just going to be really tough. Corticosteroids demonstrated improvement in most cases. Antimicrobial therapy alone wasn't consistently associated with improvement. You can't just take antibiotics or antimicrobials or antivirals or use any other methods. You have to use a bunch of them. This may include having the lungs irrigated to get everything out of it, giving a person corticosteroids to get the body to stop reacting, and giving them pure oxygen for a while and letting their lungs heal, and including a simple assertion. You will not receive any medical care if you go back to smoking anything at all. Unless you're medically compelled to do so because of something else, you have to stop smoking because that's your only choice at this point. Because at this point, it isn't something being put in the air by chemtrails because it's not hitting everybody in an area. And it's not something being put into it as an adulterant because it would be consistently doing this to a lot of people all at once. It's not doing it consistently enough. There should be hundreds of thousands of people getting this problem. What this is people are having reactions. Some of them have pre-existing conditions. But the most general thing about it is this may be just caused by one ingredient or multiple. When the stuff vaporizes after being heated and caramelizes, they can also form new materials from old. You could start off with something that has no lipids in it, and it can form lipids. Yes, fats can be formed from non-fats. Just saying. So anyway, this is what little I could find. Someone asked me to look this up, and this is my advice to every one of you who's vaping. Stop. I used to tell people to vape. I'm not going to do it anymore. I know what this is like from the little bit of knowledge I have. Well, yeah, the little bit of knowledge I have in it. Your best case scenario is to sound like me for the rest of your life. Do you want to? Thanks for watching. Have a good day. Good luck with that. You're going to have to stop smoking, and that's it. We've lost yet another alternative. Unless you can find a completely safe one. And it would be based on, ironically, something for treating bronchitis or asthma. Good day.